A little bit about LTCCC, for those of you who are not familiar, we are a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for residents in nursing homes and assisted living. We do that through policy research and analysis and systems advocacy. We do a significant amount of public education, including programs like this, but we have a lot of resources and materials on residents' rights, on family and resident council development, et cetera, on our website. And we're also the proud home to 2 local long-term care ombudsman programs here in our home state of New York. Our website is nursinghome411.org. And today's webinar is one that, unfortunately, is about a serious and disturbing issue in nursing homes that's unfortunately too often under-recognized, one about which I've been aware for many years, thanks to the good work of the Medicaid Fraud Control Unit here in New York State. We're talking about we'll be talking about privacy violations and abuse, the hidden dangers of social media in nursing homes. Our presenter today is Eylon Caspi. As you can see from the text here, Eylon has been working since 1994 in this area, starting as a nurse aide in a nursing home in Israel, if I remember correctly, where his grandfather lived and passed away. But Eylon has long been a friend of LTCCC, someone who I personally appreciate and admire for his work. There's really, I was thinking about it this morning, there's no one that cares more about nursing home residents than Eylon. He's just really dedicated to thinking about, in a critical and, not to be redundant, but thoughtful way, about what is going on with residents, how we can identify it, and how we can study it in a way, not study it academically, but study it validly and in a way that we can make a difference in the lives of residents. And again, I just have tremendous respect for him and for his work, and appreciation for his dedication to nursing home residents who we know are so often very vulnerable. And before I turn it over to him, I just want to also say that Eylon has done some tremendous work on fear of retaliation, including he worked with us on that several years ago, fear of retaliation among residents. He did some tremendous work subsequent to that for the long-term care ombudsman program in Connecticut. And a lot of that work is publicly available, I believe, on their website. And certainly some of his work is on our website as well and has been reported on in the news media. And I think without further ado, I am going to stop sharing and turn it over to Eylon. Eylon, thank you so much for joining us here today.
Thanks so much, Richard, for this too kind introduction. I will share my screen, and I'm going to minimize a couple of windows here so I can see.
Yeah, it looks great on this end.
Okay, 1 second. Okay. All right, well, hopefully that will not block the view. Okay, now it went down. Good. All right, well, thank you all for joining us today. Today we're going to talk about a very concerning issue in long-term care homes. Today we're going to focus mostly on nursing homes, but I should say that this issue happens also in the assisted living sector. And when we're referring to these incidents, what we mean is that staff members take photos and videos of residents, often with demeaning and abusive content, and then they post it on different social media platforms. And it doesn't have to be a photo or video. It could also simply be information that is violating privacy or demeaning or abusive. Before starting, I want to recognize my colleagues at Purdue University School of Nursing, Waylene, Marianne, and Leanna, for their collaboration on this project so far, and prospectively hoping to collaborate with Richard, Haley, and on this project as we move forward with it. I want to just point out that some of the content is disturbing. And these incidents have been described as the newest form of elder abuse and an extreme version of neglecting to treat a resident as a person. Some of you may know that in 2015 and 2016, ProPublica put out reports, several dozen incidents that were very concerning from nursing homes and assisted living residences, including an NPR coverage of that. In response, the American Healthcare Association recognized the nursing home companies are all struggling with this issue. So here are some examples from the ProPublica report, and then I'm going to share some examples from that were described in the media. And then we're going to move into our study. So in New Jersey, an aide took a photo of a resident's genitals and sent a picture to a friend who uploaded it to Facebook. In New York, an aide took a photo of an incontinent resident's genitals covered with feces and shared them with another staff member on Snapchat. In Illinois, a staff member recorded a coworker using a nylon strap to lightly slap the face of a 97-year-old person with dementia. The person was crying out, don't, as the employees laughed. The video was posted on Snapchat. And in California, police were notified after a video was posted on Instagram showing staff member farting in the face of a resident. The resident then said that this happens as often as once a month. In Indiana, an aide pleaded guilty for sharing a photo of a resident's butt on Snapchat. In response, the perpetrator said, "They just blew everything out of proportion. It was just a picture of her butt." How many people take a picture of people's butts? I worked in healthcare for 5 years. Everybody takes pictures of their residents all the time. I'm not the only one. In Illinois, 91-year-old Margaret Collins lived with dementia. Staff knew she hates hospital gowns, so they used them to taunt her. Her daughter said, "This is somebody's sick idea of entertainment." The woman no longer lives in the nursing home, but her family says she still has nightmares about the incident. The family filed a civil lawsuit seeking $1 million in damages. And a more recent multiple incident in a nursing home in Minnesota. These are just examples from it. One video showed a man with cerebral palsy and moderate impaired cognition was sitting half naked on his bed. A nurse aide aggressively threw him down, then threw his shoes at him, striking him in the head and chest. The aide proceeded to give him the middle finger. Another video showed the same aide throwing pasta at the resident who was sitting in a wheelchair. The employee left him covered in pasta as he tried to pick it off of himself. There was another photo in the same nursing home showing a woman holding a picture of a man with an erection. The caption on the photo was, "Showing me the expletive pics she gets." My colleague, elder law attorney Suzanne Scheller from Minnesota, in a TV segment responded to these incidents. It is just inhumane, and it just shows a lack of connection with basic human life. It's really twofold. It's one related to the physical abuse, and then it takes it to another level to make fun of the abuse on social media. Here in Connecticut, a video showed a resident seated in a wheelchair wearing a white helmet, repeatedly asking for a grilled cheese sandwich. And the caption on the video, "All I want is a grilled cheese sandwich." Now, the aide attended training a day earlier in which staff were reminded that cell phone use is prohibited in care areas. In California, a woman was living with dementia. 2 staff members took and posted humiliating pictures of her getting ready to shower. The conversation was, "Oh, she hates taking showers," and then they started laughing. The TV reporter said that breach of trust is stomach-turning. In Iowa, a person was living with dementia. CNA took a photo of him with his pants around his ankles, his legs and hand covered with feces. The CNA used Snapchat to send a picture to 6 colleagues with the caption, "Shit galore." The CNA was fired after a coworker reported her. In Georgia, 76-year-old woman had a stroke. 3 employees were supposed to monitor her while waiting on her hospice nurse. Instead, one of them was smoking a vaping pen, and they were using profanities and making obscene hand gestures at the camera. Police spokesperson said they were completely ignoring her and posting the Snapchat video with the caption, "The end." Another employee discovered and reported the Snap story. The 3 employees were arrested. This phenomenon is underreported. For example, the DA of one of the counties in Massachusetts said that there's a suspicion that such incidents are underreported, in part because many of the victims have dementia and do not realize what has happened. And in an Aging Today article by Eric Carlson and Faye Gordon from 2016, they wrote that in the most troubling incidents, the resident often has dementia and is effectively unaware of the violation. They wrote that, as ProPublica points out, the resident's lack of awareness allows the violation to happen in the first place and likely leads such violations to be underreported. But I want to balance the view a bit, because 3 studies showed that many people in early stages of Alzheimer's disease, and even a subgroup of people in the mid stages of Alzheimer's disease, when elder-friendly and dementia-friendly conditions are created for the interview, they are capable of reporting on different aspects of their quality of life, including abuse. But oftentimes, once you have a diagnosis of dementia, you're written off as if your concerns are not valid. One of the challenges we have in this area is lack of data sets and centralized tracking specifically of this form of abuse. As Brianna Hitchen wrote in her wonderful article, gathering data in this area is especially difficult to the often private nature of the incidents. But we were able to overcome this gap by using data from Nursing Home Inspect ProPublica website, which draws completed and de-identified investigation reports from over 15,000 nursing homes across the nation. Those of you who don't know, the ability to search for investigation reports has been substantially improved a couple of years ago. It's not perfect, but it is powerful, so much so that I dedicated a recent webinar solely to this website, the Nursing Home Inspect ProPublica website, because many, such as students, researchers, professionals, policymakers, can find areas of concern, investigations, and forms of mistreatment of interest in it. A really treasure chamber waiting to be opened. So our study is exploratory in nature, and the goals of our study, which is qualitative in nature, the aims are to raise awareness to social media abuse in nursing homes and to generate insights for prevention and policy changes. Now, what I'm reporting here today is only preliminary findings. I thought that given the alarming nature of what I'm going to share with you, we do not want to wait another year or more until we complete the study. So we do hope to secure funding for an in-depth study in collaboration with Richard and the LTCCC together with them. And we have a series of data elements related to the circumstances surrounding and characteristics of these incidents that goes much more in depth than what I'm sharing with you today. And the first study in the United States on this issue. Now, in this current study, we are based on 100 investigation reports from 100 nursing homes in 31 states. And they consist compelling evidence of privacy violations, HIPAA violations, and demeaning, humiliating, and abusing photos and videos that are posted on social media. We've identified 152 victims, slightly more women than men. And another interesting finding is that 85% of the victims had some level of cognitive impairment, and at least 40 had severe cognitive impairment, and that's a conservative estimate. Given the higher risk of people with dementia to this form of abuse, I wanted to share with you an article by Lance Slatton that people with dementia deserve respect on social media from a couple of years ago, and then an interview that Lori LaBey held with me. She's the founder of Elder Speaks in Minnesota, specifically on people with dementia who are targets of this form of abuse. Now, we kind of tracked which social media platforms are used out of 100 investigations. And in many cases, it's not specified. But when it does, Snapchat stands out as the most common platform used on this end to post those photos and videos. While this study is not about incidence or prevalence, I did want to share the breakdown of the states from which those investigations came from. Now, I'm going to share a series of incidents from our project. In Missouri, a man with dementia and schizophrenia was living on a secure unit. A CNA took and posted a Snapchat video showing the person walking with no adult depends or pants on. The resident sat at the dining table, exposing his genitals. The caption on the video was "Code Naked Man." When confronted by the administrator, the CNA denied taking the video, but the nursing home security footage verified that the CNA took the video. The CNA said she or he didn't know why she or he did it, and that she or he just did it. The CNA was fired. In Michigan, a person was living with moderate cognitive impairment. A CNA took a photo during a transfer and added the acronym LMAO, which stands for Laughing My Ass Off, and posted it to Snapchat. When asked how she would feel if someone took her picture without her permission, the CNA stated, "I would feel horrible if something like this happened to me. I would be very angry." The staffer added, "I realize now that doing a video of a resident without permission is abuse. I knew taking a picture of a resident without their clothes on would be considered abuse. I'm embarrassed and ashamed." In Pennsylvania, a person was living with severe cognitive impairment receiving hospital services. Okay, an aide taped the person's nose to resemble a piggy face. The video recorded the person singing and posted it on Snapchat. In Indiana, a woman was living with Alzheimer's disease and moderate cognitive impairment. CNA1 took a photo of her laying exposed on the floor with a soiled gown. The CNA sent the photo to CNA2 via Snapchat. A former employee received it from CNA2 and reported it to the health department. The director of nursing was shown the photo and identified the resident by the lamp sitting on her table. When asked why she took the photo, CNA1 said she was having a bad day and that she took and sent the picture to vent to her colleague about how her day was going. She did not think that CNA2 would share the picture with anyone else. In Texas, a person living with Alzheimer's disease and severe cognitive impairment, CNA2 video recorded CNA1 tickling the person's nose while asleep and laughing. The video was posted on Snapchat. CNA wrote she did not mean any harm and she was sorry. CNA2 wrote she was sincerely sorry. The CNA's employment was terminated. But again, there's always the question, what's happening after that? Unfortunately, the data in our project often doesn't allow us to know what happened afterwards because we all know they can cross the street and start working in another healthcare setting. In Minnesota, a man living with paralysis of all extremities, who was cognitively intact. He said that two aides washed his hair, put hair extensions in it, took pictures of it, and posted it on Snapchat. "It was done to make fun of me," he said. He said the incident was humiliating and he thinks about it every day. The unit manager said he had been more depressed since the allegation. In California, video showed two aides laughing while gluing fake eyelashes on a resident while she was sleeping. The administrator recognized the video was a form of mental psychosocial abuse because it was humiliating to the resident. And in Michigan, a person living with cognitive deficits, two staff members were twerking in his or her face. The resident seemed very offended by it. The video was posted on Snapchat. In Illinois, a person living with Alzheimer's disease and severe cognitive impairment, a video showed a CNA holding up her or his arm, jiggling the loose skin, swinging it back and forth. The caption had crying emojis on it and said, "Don't leave your family members with her. She plays with their skin." An agency RN saw the video on social media and immediately recorded and showed it to another employee who contacted the family. The family was disappointed, upset, and discouraged. The medical director said, "This is unforgivable. I'm feeling very terrible about this. What if this was me or my family member? I would want action taken right away. Or if it happened to one of their family members." In South Carolina, a woman was living with dementia. Cognitive assessment was not conducted due to being rarely or never understood. A video posted on Snapchat showed two CNAs mocking and laughing at her. We ain't got no wee-wee for you." The resident could be heard yelling and telling the CNAs to get out. At one point, the video showed a linen covering her upper body and head while her legs kicking as if she was in distress. One CNA continued to laugh out loud. The two CNAs were suspended pending the investigation and subsequently terminated. In Oklahoma, a person was living with dementia with severe cognitive impairment. CNA took a photo of him from his chest to his knees with feces up and down his legs. The caption, "This is how my morning is, shitty. But for this extra $20 an hour, I get off early, so it's a win-win." The CNA posted the photo on Snapchat. Also in Oklahoma, a woman living with dementia and severe cognitive impairment, she was recorded being taunted by two CNAs. She was told she could not lay down after she requested to lay down. The CNAs held her hands down and gave her wet wheelies, which is wetting a finger with saliva and putting it in her ear. The video was posted on Snapchat. And in Oregon, a person was living with dementia and schizophrenia. She or he repeatedly wanted to make funeral plans for a deceased relative. Two CNAs recorded a phone call between themselves and the person. While laughing, they pretended to be funeral home staff and discussed funeral plans. "We have cardboard coffins and we are on so-and-so street." The employment of the CNA orchestrating it was terminated. The second CNA was disciplined. The second CNA said it was poor judgment. She felt bad for participating in the incident. And in New York, a woman was living with Alzheimer's disease and severe cognitive impairment. The CNA pulled a wig off of her and hit her on the head with it. The CNA then posted the video on social media. In Kansas, a woman living with dementia and severe cognitive impairment, nurse aide recorded nurse aide 2 taunting her with a baby doll. Okay, the aide teased her by running the doll in front of her face, which made the resident swat and bite the doll. The video was shared at a high school basketball game. In Maryland, 2 staffers posted abusive commentary in an online forum about a woman with a diagnosis of described as morbid obesity. She's having her boyfriend feed her through a funnel so she can become the fattest on earth. A coworker commented in the online forum, "Girl, take his or her name off social media because we all be sitting in court." The regional director of operations and the quality assurance consultant did not see or treat the allegations as possible abuse. It was not reported to the state survey agency, and it was not internally investigated. It was a former employee made the resident aware of the post. The resident complained to the state agency. Citations were issued, including immediate jeopardy. The perpetrators apologized to the resident. And in Missouri, a person was living with obesity and dementia. Video showed him exposed on the floor with the caption, "Tonight's vibe," with 3 laughing emojis. The resident was interviewed by the surveyor, who said this makes the resident angry, hurts his feelings, and makes him or her sad that someone will do that to him or her. And in California, a man living with a heart failure and dementia, CNA took and posted a photo with explicit and offensive sexual remarks. "I want to F you and want to suck my so-and-so, and come get your daily dose of resident's name," they identified. The nurse said it made her sick to her stomach and upset her. Another CNA took a picture of the post and reported to the administrator. The administrator didn't conduct a formal investigation and did not report it to the state survey agency. He said the image was crude and always inappropriate, but in his opinion, it did not rise to the abuse level. He said that the resident was not, alert or aware in relation to the circumstances, so I'm not sure it caused harm. Other incident, one resident with cognitive impairment struggled tremendously to sleep at night. So in the middle of the night at 3:30 a.m., an aide took a photo of the man with eyes closed in bed with the caption, "Grown-ass man acting like a baby and making me sit with them." One person fell off the bed. The video showed the person while naked on the floor smacked on the butt by a CNA. In another incident, in a photo showing a person with dementia wedged, stuck in between chairs, staff used to block the dining room entrance until meal service was ready. And you can see the caption on the slide that was on that photo. In another video, 3 residents were watching TV. The caption, "Old pervs," with a vomiting emoji face. A resident with severe cognitive impairment was eating ice cream and saying nursery rhyme on a video posted to social media. In another video, staffers were encouraging a person with dementia to use a vape pen with laughing emojis. Another video with the caption, "I'm high as F arguing with this N-word." And a photo of a resident in a wheelchair with the caption, "Happy birthday, just turned 21. come get expletive de-identified. These are the incidents I wanted to share with you. So in summary, what we're seeing is beyond gross and abusive violations of residents' right for privacy and confidentiality, the photos and videos contained demeaning, humiliating, abusive, and dehumanizing content. Some reactions over the years to these phenomena and incidents, describing it as an emerging threat, a new type of mistreatment. This type of behavior is cruel, deeply disturbing, an appalling act, absolutely disgusted. It violates the human dignity of the resident and described also as a crime. In terms of impact on the victims, of course, loss of dignity, trust, and relationships. And Eric Carlson and Faye Gordon wrote nearly a decade ago, posting inappropriate photos demonstrates a failure to treat residents with dignity and respect. Specific impact on victims included embarrassment, feeling humiliated, feeling dehumanized, devastated, crying, feeling violated, anxiety, fear, depression, inability to sleep, and withdrawal. We also have to make sure that in the more advanced stages of dementia, that we apply CMS reasonable person concept, okay? CMS as guidance to all state surveyors across the country. The guidance state that to apply the reasonable person concept, the survey team should determine the severity of the psychosocial outcome on a reasonable person. So we have to remember that a lot of people in advanced dementia may not be able to recall details or report on this form of abuse. In other words, what degree of actual or potential harm would one expect a reasonable person in a similar situation to suffer as a result of the non-compliance? And I'm going to give you an example that illustrates that concept. A woman was living with Alzheimer's disease and severe cognitive impairment. CNA took a video showing her slouched in a shower chair, exposing her bare body. There was a large amount of feces on the floor. The CNA posted the video to Snapchat with the caption containing a loudly crying face emoji. The CNA's cousin called the nursing home to report the video. Now, one could wonder what would happen or not happen if the cousin would not report it. So the state surveyor in that investigation wrote, based on the reasonable person concept, a reasonable person would have suffered serious mental emotional harm from the video of this nature posted on social media. Based on the reasonable person concept, she suffered humiliation through the social media post. And the victim's representative was absolutely livid about this incident. Another incident, a family member said that their relative would be appalled, just devastated, just be beside themselves if they knew the video was on the internet. So one of the things that came up in our preliminary review of those 100 investigations is a series of misconceptions which could serve as the basis for education of staff and managers on this issue. The first misconception has to do with digital trail, okay? So a perpetrator of this form of abuse would say, well, I set it to automatically disappear, or it disappeared after being viewed. Some employees think the photo or video will disappear and no longer exist within seconds or whatever predetermined period of time or once the intended receiver sees them. But in reality, receivers can and do take a screenshot or video record the image, and then it can have a life of its own. A photo or video deleted may still live on a server or in cyberspace, and it could be discoverable in court of law. And, as happens oftentimes, perpetrators' co-workers, friends, family, or community members may report it. Another misconception touches upon taking a photo or video only of a body part, okay? But you can't see her face, the perpetrator said. Or it was just a picture of her butt, as we saw in the earlier incident that I described. Well, I'm going to provide a real incident that demonstrates this issue. A woman was living with who was cognitively intact, and A took a video of her on the toilet with feces running down her legs, with a demeaning caption, "Now I'm pissed and ready to F go." She thought it was okay because she covered her face and upper torso with a cartoon character emoji. But what happened is that the victim's brother identified her rainbow tie-dye Crocs she was wearing. The resident reported increased depression and anxiety following the incident. She did not feel she could trust anyone at the nursing home after the incident and wanted to go home. And CMS relates specifically to this issue when the photo or video shows a body part without the resident's face, and they provide specific guidance to state surveyors across the country on this issue. Another misconception, it was only a photo of her bedroom. Well, staff taking an unauthorized photo or video of residents' private space, such as their bedroom or even their furnishings, even when the residence is not there, is considered by CMS as a violation of the person's right for privacy and confidentiality. Another misconception, he was asleep, so not aware of it. Still a violation. When the resident learned about it, he became upset, and the reasonable expectation of privacy standard must be applied. Another misconception, she has dementia, she doesn't understand and won't remember anyway. Still need to apply CMS reasonable person concept, and when her family discovered it, they were outraged. It was only a photo of the residents by the nurse's station. Well, but when you look closely, the medical records with their names were seen in the background. It was a HIPAA violation. In another nursing home, the names of 7 residents were shown on a visitation sign-up calendar that was posted on Facebook and was publicly accessible. Or a panoramic video of co-workers in the dining room, but guess what? There was a resident shown in the background. Or just photos of 6 residents at a Christmas party were posted on nursing home's Facebook page, okay? No informed consent specifically for those photos. Or photos of residents during indoor-outdoor events. The administrator did not think the nursing home had to have residents' consent. Therefore, it's not surprising that the new activity director was not told anything about the need to seek permission. Or CNAs would say, we were just having a good time, okay? We were just dancing together on a video. She added, the app I used to record the video wound up posting it to social media. The nursing home was issued an F600 state survey deficiency citation for abuse. And the resident said, I would not have given permission to be video recorded. Why would anyone need to record me? That doesn't make any sense. It was only a FaceTime call. A person was living with severe cognitive impairment. A CNA made a FaceTime call to a friend during work, talk about professional boundaries. It showed the CNA making a demeaning gestures with her hands towards the person and pulled the cover over his or her face. The friend recorded the call and texted it to the administrator. The CNA's employment was terminated. This is the last part of this presentation. We're going to draw some areas for consideration based on our preliminary review of these incidents. Kind of pointing out to the high level of culture in our society where everybody's glued to their phone and addicted to their phones, and they have this urge to share everything on social media without filters oftentimes. And as Brianne Hitchen wrote in her article, many social media users, especially young people growing up in the social media age, fail to perceive the risks of sharing an embarrassing or humiliating photo or video of another person online. And when you look at the age distribution, for example, of Snapchat users, and you overlay it with the age distribution of director staff in nursing homes, you see that there's a substantial overlap in the age group among the young age groups. So of course, we must make sure that nursing homes and assisted living residences train all direct and indirect employees on residents' rights in general, as well as on privacy and HIPAA violations and laws, as well as on reporting requirements, including mandatory reporters laws. They must address this issue in orientation in services and on-the-floor education to staff and managers. There has to be a zero tolerance policy. You have to make sure that all employees are aware of potential consequences, whether it's employment termination, report to licensing boards, criminal charges, and jail time. Educate residents and families and friends about the issue and their rights. Make sure that you have policies and procedures. All on and off-duty employees must be aware, and they must read and sign that they understand the policy and procedures. And facilities need to enforce the rules, not just have them. And they also must immediately and thoroughly investigate upon suspected violations and report it to the state survey agency and, when appropriate, to police. As the Health Department of Wisconsin writes, snapping pictures puts your job at risk. For example, a former dietary aide said she didn't know that a few seconds video could have consequences. The video showed the residents smoking in a funny way. Her employment was terminated. Every nursing home in America and in another country, and assisted living as well, must have a social media policy that protect residents, but also employees and the care home. And why also employees? Because employees also have rights. They have a right for self-expression. They have a right for networking. They have a right to complain about the care home. They have a right to support each other. They have freedom of speech rights. And there's also labor relations laws that need to be factored into the social media policy. The policy should define what employees can and cannot do on social media. And if written correctly, it's essentially a code of conduct that clearly defines what the care home expects from its employees when it comes to online behavior. And that policy must be posted in a prominent place that all residents, families, and staff can easily see it. And the policy must be frequently updated given the rapid pace in which social media technology evolves. Now, I want to highlight the point that it's not just posting it on social media. The fact that you take a photo, the fact that you keep it on your phone, it could often be a violation of privacy, and it could also be abuse. And so it's prohibited. For example, one nurse in our project said that her 4-year-old and 5-year-old grandchildren were playing with her phone, and they must have accidentally posted on Facebook a wound care photo of a person with dementia. The resident's family were very upset about it. The nurse's employment was terminated for HIPAA violation. In another case, this goes back to the issue of keeping photos on your phone. 25 pictures were discovered on Aid's phone during an unrelated criminal and police investigation. So one of the messages today is that employees should only be allowed to use their camera-equipped devices during their meal breaks and stop breaks. And even then, it must be done inside staff rooms, away from residents, not in bedrooms or bathrooms and any common areas where residents are present. This is an example of a policy of a nursing home in Indiana, and you can learn from it, adapt from it, build on it. There could be extremely rare, whether it's emergency situation for a particular employee, but that should receive a special authorization from a supervisor for that particular shift. Other than that, the devices must be stored in a secure place, except during stop breaks and lunch breaks. But again, it has to be restricted and not in resident areas. So cell phone policy, absolutely no cell phones usage in care areas. Personal camera-equipped cell phones, smartphones, and related devices are not permitted in care areas. One administrator said phones are not supposed to be on the floor at all when clocked in, only while on break in designated break areas. But we know that there's a reality. You go into a nursing home and you see multiple staff members with their phones. So there's a gap there that we must enforce and make sure that doesn't happen, except for those extreme rare circumstances. And I want to point out that I published a blog post with some ideas for providers about how they can prevent this form of abuse on social media. And I want to call to action the need to strengthen CMS, the Centers for Medicare and Medicaid Services, that oversees care and safety in over 15,000 nursing homes across the nation. And state survey agencies must strengthen the oversight and enforcement specifically on this issue. There's specific state survey deficiency F tags, whether it's F583, which is the right to privacy and confidentiality of records, whether it's F550, which is the right of residents to dignified existence, F557, the right to be treated with respect and dignity, F600, the right to be free from abuse and neglect, F607, which is the requirement to develop and implement abuse and neglect policies, and F609, reporting of alleged violations. And then we also have under the Affordable Care Act a requirement for reporting of reasonable suspicion of a crime, which also has a state survey deficiency citation, F608. And there's a CMS memo specifically for reasonable suspicion of a crime. Well, I'm suspecting it's not being implemented to the extent that it should, because a lot of people don't know about it. And also, we need to strengthen HIPAA enforcement, such as civil and criminal penalties, and this should be executed by United States Department of Health and Human Services, Office of Civil Rights. And this is the memo that I was referring to earlier. I wanted you to have a link to it. But Brianne Hitchen has a concern about it because she considered the non-legislative rules and that are non-binding. The CMS memo describes how CMS plans to interpret federal laws and exercise its discretion. But the issue, she writes, with this method is that it's merely that, an interpretation. So there might be a gap there. Also, role of other agencies. I'm not going to go through all of them, but obviously the long-term care ombudsman program across the nation, whether it's educating residents on their rights in this context and advocating for them, whether it's making sure that perpetrators are reported to the nurse aid registry, or if it's a nurse to the Board of Nursing, or, including timely, I should say, disciplinary actions. Law enforcement need to be aware of it and act swiftly and forcefully on this issue. And then you see other agencies, as Richard mentioned earlier, even the Medicaid fraud control units. One of the strongest one is actually in the state of New York, that are, my understanding, addressing this issue. And then again, policymakers and lawmakers, we need to make sure that trade associations are on top of it with meaningful national campaigns, educational campaigns. Here are a couple of resources and guidance and legal risks evaluations on this issue that I wanted to share with you. And Argentum, which is the Assisted Living National Association, in their safety key training, address this issue. They say prohibit picture taking of residents using staff phones under any circumstances. And I wanted to highlight the wonderful nurse's guide to the use of social media that was published a year ago with myths and misconceptions about this issue. We need to also make sure to bridge gaps in federal and state laws. As Brianne Hitchen highlights, we need to ensure that federal and state laws allow prosecutors to pursue justice for victims in social media abuse cases. Although there are federal laws that could potentially apply to nearly every reported incident, the appropriate federal agencies have not taken the necessary action to enforce those laws. States should adopt criminal statutes to punish the act of capturing and disseminating those images, even though there are federal and health laws or state criminal laws that exist that potentially could have been used to prosecute the offenders. Those laws do not directly address social media abuse of long-term care home residents. So we need stronger federal leadership in this area, and federal and state laws lack specific language on social media abuse in long-term care homes, whether it's with regards to dignity and respect, mental abuse, invasion of privacy, reasonable expectation of privacy, that are not included in many state laws on social media abuse. Criminal elder abuse state laws often lack criminal liability for staff members, and HIPAA law is essentially outdated when it comes to the ever-evolving world of social media. So we need to increase criminal prosecution. Perpetrators often go unpublished. According to one estimate by ProPublica, only less than 1/3 of incidents resulted in criminal charges for perpetrators. So there's a gap there. In a recent disturbing extreme case, a video showed an aide mocking a resident who was lying dead in bed with her mouth open. Other videos showed residents on the toilet naked, or on the toilet or naked in bed. The 21-year-old perpetrator sent degrading photos and videos of the residents 66 times. Okay, the offenses involved 15 residents, and the person received 12-year prison sentence. But that's a rare. I've yet to see such sentence so far. We have to make sure to hold lawmakers and others hold social media platforms accountable. What are they doing on their end to monitor and swiftly remove content that is abusive of older adults and others in long-term care homes? Okay, they need to increase collaboration and reporting to law enforcement. And I added here links to some of their guidelines on their website. And when I presented a full presentation to the head of safety of Snapchat several months ago, her reaction was it's deeply disturbing. However, Snapchat, well, rightfully has heavy focus on protecting children, teens, students, and young adults on their platform, whether it's with safety guidelines and centers, a parent center, education initiative with school administrators and others, and public awareness campaigns. Not a single word on protecting older adults and those living in long-term care homes until February 2025 as a result of my communication with them. And I'm quoting here Evan Spiegel, who is the founder and CEO of Snap Inc. he says in a U.S. Senate committee testimony, we want Snapchat to be safe for everyone. So hopefully their action will follow their words. And I want to close here with a United States Senator Richard Blumenthal, who responded to this project in a Connecticut Mirror article. People in long-term homes have the right to be treated with consideration, respect, and dignity. He urged social media platforms to take action and to protect older adults. This research is deeply troubling and shows how often people's privacy is abandoned in favor of a cruel joke on social media. I urge these platforms to be vigilant of this content and remove it promptly to protect residents who cannot consent or defend themselves. And in closing, people have a right to be free from privacy violations and mistreatment through staff misuse of social media in long-term care homes. And I want to thank you for joining us today. I hope you found it useful, and we're going to open it to questions and discussion. So thank you all.
Elan, thanks so much. That was quite moving and informative and disturbing. I'm going to share my slides. Thanks. Here we go. It off. Just 1 second. I just have a few closing slides, and then we'll open it up for Q&A. Sorry about that. Just 1 second. Okay. For some reason it goes to my. There we go. Okay. Please join us next month, May 20th. Our webinar is going to be on the historic impact of COVID-19 on nursing homes and the failed response. And this is something about which we've been very concerned, that we hear reports from very widespread reports, I should say, of nursing home care having been significantly degraded during the COVID pandemic and not recovering. Resident numbers have recovered for the industry. The number of residents are close to or about the same as they were prior to the pandemic. But unfortunately, the often horrific issues and concerns we hear about abuse and neglect and violations of even the most basic care and dignity standards in nursing homes have been increasingly prevalent in the years since the end of the public health emergency. So we're going to have a guest speaker, Ken Levine, who's actually done some really important legal work in this area and also just had an article published. I'm not sure if it's out yet, but I know it was accepted for publication a couple of days ago. And you can register there at bit.ly/May-2025-webinar or on our website. Head to our website, nursingHome411.org. For materials from today's webinar, they'll be available, I would say, by Friday, if not by Monday. Follow us on Instagram. We're also on Blue Sky now and on Facebook, of course. Visit our Learning Center for fact sheets on nursing home standards, assisted living guides, and actually, as I noted in the chat, our Resident Abuse, Neglect, and Crime Reporting Center, which has information to support the reporting, effective reporting, and cracking down on resident abuse, neglect, and crime. Again, I'm going to now stop sharing, and we can open it up to questions. Okay. So we have a lot of questions, 19, and we have 10 or so minutes left. So I'm going to go through them as quickly as we can on my end, but I want to have time for Elan to be able to answer as many as he can thoughtfully. So an anonymous attendee wrote, sometimes facilities use social media issues as a pretext to restrict families, residents from using technology of their choice. When my state adopted a virtual visitation monitoring policy, facilities began narrowly construing the new rules in order to limit virtual visitation monitoring. When pressed, the facilities raised that the issue risk of social media abuse being raised here. My concern is that facilities want to restrict all social media, even resident or family use, as a means of to conceal conditions within their facilities and the public. How should advocates navigate this side of the issue?
Well, that was a lot. And so if I understand it correctly, first of all, this is people's homes, okay? and residents have a right to take a photo or video, but they have to be respectful of other residents' rights of privacy and dignity and confidentiality, obviously. Um, there was a mention there of visitation, restricting visitation through social media, which is a slightly separate issue. But to be honest, I'm not fully sure I understand the question. I wonder if there could be a clarification there, or maybe Richard, you picked up on something
Yeah,
there.
I mean, I don't think we're gonna have time for clarification from the writer, but I think that as I understood the concern, it's that, facilities will say, oh, we have these, we want to protect people from social media abuse, say, what you've been talking about today. So therefore, you can't have a social media platform in your room. You can't be visiting with friends via your iPad, for instance, or family. That
I
kind of
see.
thing.
Yeah, thank you for clarifying. So, yeah, so again, this is their home and their room is their last frontier of privacy. And they should be allowed to take photos in their home as long as they're respectful of other residents' privacy and dignity. Yeah, and so there is a concern that it could spill over to that. And of course, and we have to be mindful because there are incidents when residents go out, for example, to the public space and take photos trying to, when they're desperate, when there's poor staffing, and that's a real incident that was shared with me, and they just put it on social media, but they're showing other residents who did not give consent. So there's a balance there. I want to highlight that in Connecticut, there's an innovative law for over a decade that, I'm sorry, that a few years ago during the pandemic, they passed a law allowing residents to use any technology of their choosing, with again, with the premise that this is their home and staff are working in their home, not residents living in their workplace. So that should be the starting point for a conversation like that. And yet, so I believe that care home, the nursing home, should not restrict residents' right to use devices in their bedroom as long as they're doing it in a respectful and dignified way for others.
Yeah, I of course completely agree with you. I would just, if I may quickly add that I think that, the part of the issue is that too often operators think like they think very monolithically when it's their responsibility, they're caring for vulnerable human beings and they're responsible for their well-being 24 hours a day, obviously 7 days a week. And it requires more than just a very rote rule. This is not herding cattle. This is not, being operating a storage unit. You're dealing with human beings, and therefore it requires some level of thoughtfulness. It may not always be a clear-cut rule, but as Eilon was saying, there are clear-cut rights for the individuals for their protection and also for their rights to have, video or whatever in their own home, how they're using that. Thanks, Eilon. So I'm going to move on. Lori Croft asked, how are social media companies flagging these? And you got that a little bit at the end, but I don't know if you had anything you wanted to add, Eilon.
Well, from my conversations with the head of safety of Snapchat, which is huge in the United States in terms of users, she said that they are looking at it in a broader way in terms of abuse, bullying, and sexual abuse in a broader term, and they have ways to detect it and then refer incidents to law enforcement. How strong it is, how frequently they do it, and how much targeted effort they do in long-term care homes, that's a question mark. I don't know. But based on our conversation now, that for the first time, they have the words older adults and they have the words assisted living and medical care homes, but they don't have still the word nursing home, even though I urge them to do that. And that's not enough to put words. You have to have specialized knowledge of detecting those incidents that are unique in nature to older adults, such as those with dementia being abused. It remains to be seen how much they actually put effective effort on this front.
Thank you. We have a lot of good questions. So if I skip your question, please don't take it as my thinking it's not valuable. I just want to pick out some that I think will be of most use to the most people. So the next question I'm going to ask is from Peter Whitehouse. Says, great work, Elon, very depressing. How do you think technology, remote monitoring, robots, etc., might affect abuse for the better or worse?
Well, it's a great question. Well, under the Connecticut law that I mentioned, now residents are, have a right to use any technology of their choosing in their bedroom, as long as they're respectful to the dignity and rights of other residents and roommates, for example. But they're now, the ombudsman is receiving videos directly from residents who are taking those photos. So that's one example. Another one is cameras inside bedrooms. Okay. So, there was a recent New York Times article about this, and it varies by state law, but in many and nursing homes, residents can and families can install a camera under particular conditions that are determined by the state. And then they could monitor their loved one if they're, for example, in advanced stage of dementia, and they could become alerted to mistreatment and abuse. And there's many incidents like that over the years. So that's another way of doing it. Technology could be used in many ways. Another one is Connecticut is very innovative, the Ombudsman program. Residents can now, many residents have cell phones, not everybody can afford it, but those who can hover over a QR code and it goes directly to the Ombudsman program. Is
Wow.
another creative way. Another resident couldn't attend resident council because I don't like the word bedridden, but creatively they put a projector in their room and they projected the resident council on the wall inside the bedroom. And there's all kinds of other innovative technologies that could be used. But we also, sometimes it's the basic things. A lot of residents don't have cell phones, or they're reliant on the phone in the nurse's station, and they literally don't have the ability to communicate their concerns with the outside world. It's a huge concern, it's a major gap, and good luck getting the phone in the nurse's station that is always busy or misplaced, or the batteries are done. So I believe every resident should have the right to have a phone, a working phone that is discreet in their bedroom. So this is just examples.
Thank you. And I would, if I may just add that it's always been our position that, as you said several times earlier, Elon, that it's the individual's home and they have the right to install a camera or anything else they want in their home, as long as it doesn't intrude on other people's on other people's right to privacy. So those state laws actually worry me, because by confining it, it may make it more difficult for people to be able to implement their own right. I mean, they have a right to do that, and if the law restricts it, then that could be, that could be a difficult hurdle for them. So
Right.
I think,
Yeah, one more, if I may just say something real quick. One of the concerns with technology is sometimes it substitutes human connection. And we have to make sure that the human connection, the low tech, is the most important thing, the relationship-based care. And if you can complement it in an innovative, effective way, that's okay, as long as residents' rights, dignity, and safety are protected. And as long as it's based on their wishes, right? So it's a delicate balance there. Just wanted to add that part.
so I just want to go to one other kind of person raises the issue, and then there's some questions related to it, which I thought was just very edifying, and then we'll have to close. But anonymous attendee asked, after a woman's care surgery, my wound care nurse put her unsanitary cell phone light inches from my privates that had just been operated on, and I told her to put her phone away. She got angry and said, I'm so picky, said I need my light to see patients because the lighting is bad in the facility. I reported it to the facility and nothing happened. She's very protected here because she lies a lot to agencies. She still uses her cell phone to take pictures of wounds and uses her light. And the question is, what are my options now? She has loads of images of residents' wounds on her cell phone.
Right. So it could be, well, first of all, the very fact that they take the photo without authorization, it's a violation of privacy, and it's an abusive violation of privacy because of the private parts. And then, is this a designated encrypted phone that is used in the nursing home for sharing clinical information for wound care, for example, or is on the nurse's own discretion, feeling this power over the resident? I'm going to do whatever I want, kind of thing. So if it is the latter, then that that nurse is basically, sounds like on the face of it, without knowing all the details, is a form of abuse, and it should be, the state survey agency should be all over it, and the ombudsman should be advocating for the residents' rights of dignity and abuse rights. And so to me, it seems pretty straightforward, but I'm not familiar with all the details there. Yeah, and especially that the resident is reacting that way, right? And who
Right.
else is she doing it to?
Yeah, apparently other people as well. Very concerning. I mean, I understand the person may be trying to do the right thing, but they're not, and or they're
Right,
implementing. Yeah,
right. And wouldn't care again with consent, and it must be on a designated phone that is encrypted for clinical purposes that is approved, and not just on anybody's phone.
yeah. Thank you. That's great. I'm glad that we asked that question. Well, Elon, thank you very much. Really appreciate your work and appreciate you speaking to everyone here today. Thanks everyone for joining us again. Our next webinar will be with Ken Levine talking about the legal oversight in the post-COVID era. Really should be really interesting. Thank you.
Richard, thank you
Yeah.
so much for raising awareness, helping me raise awareness to this issue.
Thanks. Thank you. Bye-bye now. Bye, everyone.
Take care.